Lymphedema and elephantiasis. Lymphedemas are classified as primary congenital malformations or secondary acquired obstructions. Tissue swelling occurs in the extremities because of an increased quantity of lymph that results from obstruction of lymphatic vessels. It is especially marked when the extremity is in a dependent position. Initially, the edema is soft, pitting, and relieved by treatment. As the condition progresses, the edema becomes firm, non-pitting, and unresponsive to treatment. The most common type is congenital lymphedema. Lymphedema precox, 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 which is caused by hypoplasia of the lymphatic system of the lower extremity. This disorder is usually seen in women and first appears between ages 15 to 25. The obstruction may be in the lymph nodes and the lymphatic vessels. Sometimes it is seen in the arm after an axillary node dissection, example for breast cancer, and in the leg in association with varicose veins or chronic thrombophlebitis. In the later case, the lymphatic obstruction usually is caused by chronic lymphangitis. Lymphatic obstruction caused by a parasite, filaria, is seen frequently in the tropics. When chronic swelling is present, there may be frequent bouts of acute infection characterized by high fever and chills and increased residual edema after the inflammation has resolved. They lead to chronic fibrosis, thickening of the subcutaneous tissue, and hypertrophy of the skin. This condition, in which chronic swelling of the extremity recedes only slightly with elevation, is referred to as elephantiasis. Medical management. The goal of therapy is to reduce the and control the edema and prevent infection. Active and passive exercises assist in moving lymphatic fluid into the bloodstream. External compression devices melt the fluid proximately from the foot to the tip, from the foot to the hip, or from the hand to the axilla. When the patient is ambulatory, custom-fitted elastic compression stockings or sleeves are worn. Those with the highest compression strength exceeding 40 mm of mercury are required. When the leg is affected, strict bed rest with the leg elevated may aid in mobilizing the fluids. Pharmacologic therapy. As initial therapy, the diuretic furosemide is prescribed as needed to prevent the fluid overload that can result from mobilization of extracellular fluid. Diuretics have also been used palliatively for lymphedema in conjunction with elevating the leg and wearing elastic compression stockings or sleeves. However, the use of diuretics alone has little benefit because their main action is to limit capillary filtration by decreasing the circulating blood volume. If lymphangitis or cellulitis is present, antibiotic therapy is initiated. The patient is taught to inspect the skin for evidence of infection. Surgical management. Surgery is performed if the edema is severe and uncontrolled by medical therapy. If mobility is severely compromised or if infection persists, one surgical approach involves the excision of the affected subcutaneous tissue and fascia with skin grafting to cover the defect. Another procedure involves the surgical relocation of superficial lymphatic vessels into the deep lymphatic system by means of a buried dermal flap to provide a conduit for lymphatic drainage. Nursing management. After surgery, the management of skin grafts and flaps is the same as when these therapies are used for other conditions. Prophylactic antibiotics may be prescribed for 5 to 7 days. Constant elevation of the affected extremity and observation for complications are essential. Complications may include flap necrosis, hematoma, or abscess under the flap, and cellulitis. The nurse instructs the patient or caregiver to inspect the dressing daily. Unusual drainage or any inflammation around the wound margin may suggest infection and should be reported to the physician. The patient is informed that there may be loss of sensation of the skin in the skin graft area. The patient is also instructed to avoid the application of heating pads or exposure to sun to prevent burns or trauma to the area. Thank you.